Hi, I'm Dr. Christopher Lipari at Jacksonville Center for Reproductive Medicine. Today I'm excited to give you guys a video series on IVF and pre-implantation genetic testing of embryos and who should be thinking about that, who shouldn't be thinking about it, does it help or does it not. But first, in part one, we're going to talk about how do we get to the embryo and how do we know what day we should do biopsies on. So the first thing is that in order to get to genetic testing, we have to do in vitro. So in vitro fertilization is basically a process where we would use medications, typically injectable medicines that are subcutaneous, so just below the skin, for about 10 days on average. And we do an egg retrieval, which is about a 15-minute procedure where it doesn't require any incisions. And we would retrieve eggs with a little tiny needle while the patient is asleep, and those eggs would then be inseminated with sperm, where we put the eggs and the sperm together to create an embryo, and embryos are watched over 5 days in culture, typically to the blastocyst stage. So first I wanted to kind of just discuss briefly, like, why do we go to the blastocyst stage, which is essentially a day 5 embryo. We do that because we know that the blastocyst embryo has a much higher implantation rate, so there's a higher success rate when you transfer a blastocyst embryo typically versus a day 2 or 3 embryo, which used to be done in the past. So the day 5 embryo, basically, if we think about it just from a normal kind of physiologic standpoint, that's the embryo that's inside the uterus. We used to do transfers on day 2 or 3 because we didn't have the ability to culture embryos very well past that point. But essentially, the day 2 or 3 embryo is still in the fallopian tube. So the environment's different, and the embryo is actually kind of metabolizing and progressing with different nutrients as it would compared to an embryo inside the uterus. All right, so now we got to the day 5 embryo, and we know why we culture that long. But in the next series, we're going to talk about how do we grade these embryos? How do you know one embryo is better than another? Does it make a difference? And when do we do PGT?